Hello and welcome to the Healthcare Uncomplicated YouTube channel. Before I go ahead, make sure you subscribe to the channel, and I'm delighted to have you here and back with an audience. I have another guest for you today, and check also our partners and our previous content, all to do with healthcare technology, anything that you can imagine around digital health and health tech. And today gives me great pleasure to introduce you to Päivi Sillanaukee, and she's the ambassador for health and well-being for the Minister for Social Affairs and Health of Finland. Päivi, how are you?
Thank you for having me here. I'm fine. I just have had my long summer holiday. In Scandinavia and Nordic countries, we have long summer holidays, but I have been now working for 1 week. So I'm kind of working mood again, but
Right.
Feeling healthier after and more relaxed after summer holiday. So these are so important for our health.
Fantastic. Glad to hear that. And we are here today to discuss health, well-being, and public health. And I would like to start with the Nordic countries, especially Finland, have a very strong reputation and credibility around health tech, well-being, and health and public health. Can you give some examples of good practices where health and well-being is a priority for you?
I would say that most important is that we have in our legislation a very strong emphasis on health and actually well-being also of our people here in Finland. It is actually in our constitution, the right for everyone to get equal access to those health and social services that they need. And this really gives pressure to politicians, but also then healthcare providers, then to think how we can organize that in a quite huge country where we have only 5.5 million people living here. And that has been the kind of the basis on which we have built our system here in Finland. And then the other one is that we are a taxation-based welfare society. So people pay taxes, and in return they get then those health services, social benefits, but also then free education. And that has built a lot of trust for our people during the last decades. This began then 1960s, and then we also got identification number, which is linked to all register data we have gathered then. And we have gathered a lot of that register data since 1960s. Actually, cancer data is already since 1950s. And you can imagine when we have this data available, and then during the Nokia period in Finland, we got also very comprehensive digital infrastructure here. And that is the history where people have been using and being able to use digital devices, but also then digital tools. And I think that is now one of the main focuses in my work here, trying to then get the benefit of these digital tools and the data we have gathered here for the benefit of our population. But I also work at the regional EU level and also global level. And I think that it's so important. And we have and are living in an era where we actually have possibility through technology then to have a benefit of this new technology for everyone in each country.
Fantastic. Päivi, thank you so much. And as you well know, we both work internationally and globally. Not in every country they have access to health and the same rights. So that's fantastic. And it's really good that you have that embedded in your legislation and also in the people's mentality, mindset, and the approach centered people centered approach is really, really great. Moving on, can you highlight some barriers for patients and people in achieving a good state of health and well-being, and how can HealthTech facilitate that?
A really good question. And we are struggling now here in Finland, but also in EU, of how we can actually use AI and automatic decision making through AI. And this is a big question. I think that if we think about life expectancy and well-being during our life, then the chronic diseases is a really big burden. And the most of those chronic diseases, I would say high blood pressure is a big issue also, but we can think about mental and neurological disorders, lung diseases, and high blood sugar, for example. Then there and we know from science that some indicators then when you measure these things, blood pressure, blood sugar, cholesterol, for example, they indicate that you really have a risk, for example, strokes, cerebral hemorrhages, heart failures, and so on. And now in this situation, we actually can't use digital tools and AI for identifying these risks. We can identify and are allowed to identify at the population level, but to really identify those individuals in risk, we have challenges here in Finland because we have then interpretation of our legislation, our data security ombudsman have made a decision and interpretation that we are not allowed actually to identify individuals through these risks. And I think that this is a really big issue to talk about, because when we actually know from science that there is a correlation between some measures and indicators, it should be then possible to use these tools for the benefit of people. Because now, when we don't have that possibility, this is only one example, because of course there are other examples also, but to then think it at the population level, we are allowed to wait that the risks are coming, and we then take care of those diseases. But we are not allowed actually to identify those individuals from the physicians' population and then contact them. We just had our new government that has been beginning their 4 years period, and they are focusing also on this because they really want to do the shift from the hospital care to more prevention care, because it is not only an ethical question, it is also an economical question.
Brilliant, Päivi. Thank you so much. As you described, there are of course, many barriers, but that barrier of sharing data, being not able to use it, and not leveraging the full potential of technology is still a big challenge. There are others, and we've seen that in many conversations around the world that we have at conferences and everything. And moving on to the last question per se, we talk a lot about health equity, and how do you see the current state of global health equity, and what can we do to improve it?
Really big question. But I think that one simple answer is that actually those solutions we use in developed countries, most of them are also usable in developing lower middle income countries, because many of them use mobile phone technology. And mobile phones are quite broadly available in many countries. But coming to that, then I'm sitting in overall board of IDER, International Digital and AI Research Initiative, and there one of their targets is that we could have a mobile phone for everyone, and that would then help also low and middle income country populations to get those solutions and access to information, because most of the prevention and your well-being and health is built on the right data and right information. But then the other aspect is then that we can then secure your privacy. And I think that these are the main questions: that do we have the tools available? Is the technology really respecting the privacy? And then building in that way also possibility to gather data and use it for the benefit for everyone. So now it's time for collaboration between low, middle, and developed countries, because there is a lot of innovation capabilities and know-how on local environments in people in every countries. So I'm calling for collaboration and innovation and using this technology we already have.
Brilliant, Päivi. Thank you so much for that, and yeah, really strong call for collaboration. And we are seeing that now, the more developed countries trying to support the low-income countries, because technology is available, even though they have, of course, different needs. We can gather in different way. Thank you so much for that brilliant overview. We're coming to the end of the interview. I want to thank you for your time, for everything. I have one little last kind of question, which is to do with the channel. Uh, and I expect the short answer is a kind of a challenging question. How can we make healthcare uncomplicated?
Uncomplicated.
Uncomplicated, yeah.
Yeah. Ah. Uh, um, I think that we should have more patient engagement and people engagement into that, because we healthcare professionals, I'm physician as an education myself, so we are so in that science and wording. So I think that when we take then people and talk more about their living environments, how could then adjust their living to more healthier lifestyles and so on. So I think that would be one big step towards more understandable and uncomplicated care. And also then between professionals, then among professionals, everyone should talk together, but take the patient view in the center, patient in the center, so that trying to think all the time how we can make solutions, how we can find the way to answer the need of the patient. I think that the bureaucracy is there, and we are concentrating too much on the bureaucracy, not on how solving actually the health problem we have.
Pavi, thank you so much. That's brilliant. Patient engagement, much needed, and bringing the patient in toward in all aspects.
Yeah.
Fantastic, Pavi. Thank you so much for your brilliant input, for the global work that you do, for being available. And it's really nice to see you. And thanks for being in here with us, sharing this amazing expertise in your experience.
Thank you, Joe. All the best for you. Enjoy your holiday.
Thank you so much. I'm going to wrap up now. Päivi, thank you so much once again. To all our viewers and listeners, make sure you subscribe to the channel. Also, check the previous content, acknowledge our channel partners, and I'm going to post Päivi's contact details in here, the socials, LinkedIn, and Twitter. Engage with her, ask her questions about the brilliant work that she's doing around the world, and I look forward to seeing you all next week.